Hi, I'm Tanya Curran. I'm the co-founder of Scaly Adventures and the Director of Education, but you might know me best as Scaly Mom. I'm here with my Scaly friend Peaches, and what you're about to see is additional footage, behind the scenes things that just would not fit into that 30-minute episode. It was just so good though, because the professionals that we film with are passionate about sharing their knowledge with the next generation. So check out this educational footage and make sure to stay tuned to scalyadventures.com for a whole lot more.
Hey guys, I'm Pierce of Scaly Adventures, and I'm here with Dr. Pfeiffer, and she is the radio... No.
That's all right.
I almost said resident, so...
No. Okay, hold on. 3, 2...
Hey guys, I'm Pierce of Scaly Adventures, and I'm here with Dr. Pfeiffer, and she's the radiation oncologist here at UTCVM, and we wanted to talk to her about how she got into this career field and what made her want to do this. So, let's just get right into it. What made you want to do this?
Well, for me, I always loved working with animals and people, which is kind of like the veterinary medicine side. I love solving riddles, kind of like what's wrong with the animal. Because they can't tell us, right? I mean, you go to the doctor and you tell them, oh, this hurts, or it hurts there, or I'm feeling sick. The animal just comes in and the owner's like, something's not right, and we have to figure it out. And so what I did, I'm from Germany, so the process works a little different over there versus the US.
Oh, cool.
And here you have your undergrad and you have your grad school. So you kind of do your undergrad courses, then you go to vet school. In Germany, it's all incorporated in the vet school. So my veterinary school was 5.5 years at least. That's what I did over there. And then I knew, okay, I want to go somewhere, small animal medicine, solving riddles. I did what's called an internship. So there you kind of go through different departments for a year in the hospital. So kind of like surgery, medicine, exotics, or whatever else you pick, just to get kind of like a roundabout view of things. And then you can decide, well, this is something I'm interested in.
Okay.
And I was interested in oncology. So not only the radiation side, but also treating with chemotherapy, kind of like how do we get rid of cancer? How can we treat them better? What does chemotherapy do to them? Do they really feel as sick as humans do? And no, luckily they don't, because we want them happy.
Yeah, definitely.
We just want them happy. And then you do a specialization, which is called a residency. And then there is a residency for medical oncology or for radiation oncology. And I was crazy enough to actually do both.
Wow.
And so, but it's not necessary to become a radiation oncologist. You just have to do the radiation oncology one.
Okay. Well, that's very cool. And what are some of the day-to-day things that you deal with?
So we see patients that have cancer where we know the tumor couldn't be removed completely, or surgery is not possible because it's in a weird part of the brain, or like in the nose, or somewhere where we just cannot cut without losing the animal or losing a leg or things like that. And those are the cases where we decide, well, is radiation feasible? So if we treat them with those smaller dosages each day, can we get rid of the tumor? And then we decide, yes, this is a good protocol, or we can just try to help them with pain just because they have a tumor in their bone. It's really painful. We cannot take the leg off for whatever reasons. We're just trying to get rid of that pain for a couple of weeks to months.
Right. Well, this is very interesting. So how long did it take you from the start of your interest to get to where you are today?
Almost 10 years, I guess.
Wow.
Yeah, that was almost 10 years. It's a lot of school, but it's also fun.
Wow, well that's awesome. Thank you so much for your time and letting us get to pick your brain kind of on this very interesting aspect of killing cancer. This is really cool. This is awesome.
So this is a cool opportunity that we get today here at UTCVM. We're here with Dr. Ward. We're in the ophthalmology exam room, and we've just filmed a segment that's going to be on Scaly Adventures in a TV episode, but now we get to do a little extra for YouTube, a little behind the scenes, and learn a little bit more about him. Now, I know when we were talking before, you said that this was something you were not interested in from a little boy.
Right.
You actually were interested in veterinary medicine, right? And then you got here and you changed it.
Right.
Is that after you started going through rotations?
Yeah, well, with me it happened in kind of an odd way, because I got interested more so than in ophthalmology. I got interested in teaching.
Okay.
And that happens to a lot of people at UT, because they're blessed with really great professors. And I just think some of the teachers I had in my senior year of vet school, I thought I would really like to do that. You know, so I started looking at what specialties often have academic teaching jobs available.
Okay.
And ophthalmology is one that always comes to the top of that list. So that's basically why I got into it, and it's worked out well because it does turn out that I like it.
Right.
But it's kind of a backwards approach for me.
We've done a lot of things backwards.
Yeah,
like, we really have. Even, I mean, you know what, whatever works, and following your passion, and that's another thing we always tell kids to pursue your passion.
Right.
Obviously, you want to make great money in this world, to do good things and help others, but you really need to pursue your passion. So
Yeah.
you're passionate about this?
Yeah, about teaching especially, but I have loved the ophthalmology part of it as well. Yeah,
Excellent.
It's a great career.
Yeah, and you're never grossed out by the surgery part?
No, gosh, no. The surgery's fantastic. As long as it's eye surgery.
Okay,
Yeah.
so now tell me what's your favorite patient or the coolest animal you've worked on?
Oh my gosh, I wasn't quite prepared for that.
Was it a tiger or a gorilla?
We do a lot of tigers actually, but I'm not sure that I would say they were my favorites. If you want a specific name, I can remember a horse named Kai that we worked on. It's been 3 or 4 years ago now, and that horse had a horrible eye problem. And the thing that was interesting about Kai is that he had a really difficult time recovering from surgery. And it was an anesthetic recovery that lasted about 2 or 3 days, actually.
Oh, wow.
And it was really scary. And the thing that was so positive about it was the interaction with the owners, because they were so understanding about everything. And I mean, there was a period of time that we didn't think Kai was even going to survive, and there were just so many people involved in that horse's recovery. He ended up doing actually quite well. The one eye that he came in that was bad did end up having to be removed.
Okay.
But he survived, and
Yeah.
as far as I know, to this day is thriving.
He's still doing well.
So, yeah. I don't know why he just jumped to my mind when you asked that.
Yeah, well, and I was going to ask you also, is there a particular animal that's more difficult, like a gorilla versus a penguin? I mean, versus a dog?
A gorilla would be challenging.
Yeah.
The thing about
Probably to say the least.
The thing about the zoo animals is that they almost always have to be anesthetized
Yeah.
before you can work on them, and there are a lot of things we can't do when they're anesthetized.
Oh, okay.
And they all present their own challenges. Gorillas are really difficult because they've got this enormous brow ridge that makes it difficult to get into their eyes. We have done quite a few penguins, and they're actually quite easy, other than they smell bad.
Really? I didn't know that.
Yeah, they get.
They stink?
They do. They smell.
Who knew that penguins stunk?
In my view, they might have a different.
Okay.
They might be saying the same about me. I don't know.
Yeah. And how about a cat or dog? Because we've owned, I grew up with dogs, and then we
Yeah.
own cats, and we own a lot of snakes too. But
Cats and dogs are typically fabulous. I mean, considering that, with some of this equipment, we are right up in their face, and they don't know what's going
Yeah.
on, and we're strangers, and it's a dark room, and it actually is incredibly uncommon that they get unruly with us. I mean, you'll have one dog a month that might kind of growl at you a little bit, but it is just really
They go with the
surprising
flow.
they're much better than human patients in general.
Really?
Yeah.
So as snake owners, I do have to ask you this in honor of our son, Pierce.
Yeah.
How would we know if one of our snakes was having an eye problem?
Well, I guess the fortunate part for you with your snakes is they really don't get many eye problems.
Okay.
That's the saving grace. And the eye problems they do get all manifest relatively similarly, and that's with cloudiness to the eye.
Okay.
And it's the old things you'd have heard of, like retained spectacles and abscesses and things like that. They're all going to start off with a cloudy eye, and you take that animal to your vet, and they'll know right away that
Right.
that's what's going on.
Interestingly, I've seen a retained eye cap when they've
Yeah,
been
yeah.
shed before, so we've seen that. Well, this is fascinating. Thank you for welcoming us into your world.
You're very welcome.
Yeah, and you guys stay tuned to Scaly Adventures Season 4 and check out UTCVM. They are fascinating here. The cutting edge technology for the animals that they're using to improve their lives, save their lives. It's wonderful, and we're so proud to have this opportunity. Thank you.
Thank you.
Yeah,
Appreciate it.
It was great.
That looks better. I think there was all movement before. How's that, Jenna?
Probably. That's how it'd be my luck. At least that's okay. At least to live with us, we come back and get hurt a lot.
That's right.
Whoa.
Okay, so this is the heart beating on the screen.
Oh my gosh.
And this is the major vessel, the aorta, that leaves the left side of the heart. Okay, so this tells us how it's moving, or helps to tell us. And then we put on color,
Oh my
and you
gosh.
see the blood flow. So the blood flowing out of that chamber is blue, and there's multicolors because there's a little bit of turbulence, which there always is, leaving the heart.
Wow.
And then we can actually measure how fast that blood's leaving the left side of the heart.
Wow.
And that helps us look for different defects. Okay? And then this is the valve. This is the small chamber on the left side of the heart, and this is the big chamber. And this is the valve that usually leaks and causes us problems, or rather the dog's problems, not us. And then we look for it leaking. Now her valve is not leaking. So all that the red flow into the big chamber on the left side is normal.
Oh wow.
So she's doing very well with this.
So when it comes to making sure that you haven't like misdiagnosed something when it comes to these images. Like for me, it would be very easy for me to not quite see what's what's there. That kind of just looks like black and white. How do you make sure that you are you're seeing what you're seeing?
Okay, well, it takes years of training.
Okay.
And so you do a residency in cardiology. After you finish veterinary school, then you'll do an internship and then a 3-year residency in cardiology.
Oh, cool.
And so that's where we learn all these different procedures and what's normal and what's abnormal.
That's really fascinating because I cannot tell anything that's going on there.
Yes, you could with practice.
That is very cool though. That is awesome. So what are other, is that the one symptom that you would look for, a leaking valve there?
No, we have other, like small puppies can have congenital heart defects where the blood moves abnormally through the heart because of the defect. And we can tell that on this machine too, as well as we listen to the dogs, and where the murmur is helps to tell us what it has also.
So how many dogs do you usually see a day?
Oh, in a day it varies. We could have as few as 4 up to as many, I think we've done 10 or 12 in a day.
Wow.
So it just depends.
And do you only do dogs and cats?
No, dogs, cats, horses, gorillas, snakes, yeah, penguins, birds, we do all species.
Now, as a snake owner, I've just, out of morbid curiosity, I have to know, what do you look for in snakes? What could be a problem that would occur
Well,
with
years
the snake?
ago, we used to have some snakes at the Washington National Zoo and at our zoo that developed fluid in the sac around the heart.
Oh, wow.
And so we would find that on ultrasound. Now, we haven't had that in many years, and so I haven't seen as many snakes recently.
Well, that's good.
Oh, yes, it is good. We don't know what caused it.
Even worse. Thank you very much for showing us this. This is
Oh, you're
cool.
welcome.
Hi, can we come this time? He's like, visitors.
About it's okay, mister. It's okay. Such a little chunky.
My cell phone is sitting over there on that cart. Can you just turn off the GoPro? We're not ready for it yet.
I'm trying to leave your cell phone.
Turn it, just press that red button to turn it off. Thank you, ma'am.
And so they're going to put all the monitoring equipment on, an ECG, CO2 for exhaled CO2, a pulse oximetry for oxygen saturation. He will be hooked up to gas, so isoflurane and oxygen. He has a saline drip right there to give him some fluids. We'll have blood pressure measurements on there. And while they are doing that, I will be turning the lights off and setting him up for the radiation treatment field. So, and the nice thing about this table is we can move it. So we don't have to have him perfectly in that area. And as you can see, this is the scar right here. And we want this scar and then a wide margin around it, because when the surgeons did the surgery, they put little clips in there that we can see on x-rays and on a CT scan. And we know that they have a clip up here, and we know that they have a clip down there. So we want to include all of this in a radiation field. That's why that looks so wide around the scar. But we know that they left tumor cells behind, and that's exactly where they left them behind. So we want to include all that area. And now for those calculations, he just has to be at a certain distance from where the radiation comes out, which is 100 centimeters for him. That's why I have that little digital scale right here that I can see. So you just want to, yeah. And he's right at 100 centimeters away from the source. And then we have this little marks on his fur to make sure that we are around kind of like the scar, at least 3 to 4 centimeters around the scar. That's what we want to treat, and that looks really, really good right here. Check from the other side. Yeah, that's perfect. His elbow is out of the way. Wonderful. And that's all that it is for him, just because it's like on the chest wall. We have a really flat field. We can use this nice little contraption where we treat with electrons, not with x-rays, but with electrons, which are very superficial. We know exactly that after a certain depth we have no dose, so we're saving his lungs and his heart.
Wow.
Because we know there's no tumor in there, so we don't want to treat them, and with the electrons we're able to do so.
Right. Remember that there's there's layers, and she says that's a great question to say. How do you know that when he's getting treated that it's not hitting other organs? And did you hear what she said? That was another. She said it has to be measured. They do it wider. These are some questions she asked.
Whenever anesthesia is ready, we are ready to move outside and...
Tanya, activate the GoPro.
I do that by...
Press that red button.
What we're treating with, the energy, where he has to be, which contraption has to be on there, how long it has to be on. And then I just send it over to the machine and tell the machine, yep, we're ready. Yes, that's what I want to do. It calibrates, and then I just push a button. Turn the key and push a button. And the door has to be closed. And now you can put your counter on. It's just under a minute.
Wow.
It's very presidential, like the big...
I know, it's like...
Yeah, very...
Yeah, and then you see it blinking here, beam on, this thing is on. Our radiation monitor over there shows, yes, we're given radiation.
And then you can see the animal here as well.
Yeah, you can see the animal down here. That's where Sabrina can watch him. And then up there we have all his parameters, like his ECG with the heart rate, his pulse oximetry, so oxygen saturation. That's his CO2. That's like how he's breathing.
Okay.
Those little bumps here, his blood pressure.
Which is not accurate at the moment, but it's not breathing.
Yeah.
It's saying weird. Well, his little stumpy legs. Have you ever had to stop it because of an animal having an issue with it, or no?
Yeah.
Hey, Tanya.
Oh, anyway.
We had, unfortunately.
Okay. That probably happens with humans too, right?
They are not anesthetized. You just tell them to hold still.
Oh, okay.
And that's it.
The word.
Now we can go back in and wake him up.
So he does that for 10 days in a row?
16.
16 days in a row.
16 treatments, Mondays and Fridays.
Okay.
Once a day. Yeah, so most of those protocols are trying to cure them.